Hi, everyone, and welcome to our focus session about Nora. Nora is a virtual assistant for clinicians built here at Northwell Health in collaboration with Microsoft Teams. Thank you so much to InterSystems for the opportunity to tell your audience a little bit about Nora today. I'm Kim Humby. I'm the Director of Product Innovation for the Northwell Health Innovation Center here in the New York City area. And I'm really excited to be joined today by Dr. Dan Baker, who's one of our top Nora users here at Northwell. Dr. Baker, do you want to introduce yourself?
Absolutely. Thank you, Kim. I'm Dan Baker. I am an emergency medicine physician by training, and I am the medical director at Lenox Hospital. We are about a 450-bed hospital on the Upper East Side of Manhattan, a tertiary care facility with specialties really in obstetrics, cardiology, orthopedics, and neurosurgery.
Awesome. Thanks, Dr. Baker. And I'm sure some of you have seen the Netflix special focused on Lenox Hill that came out earlier this year. We're very proud of that here at Northwell. So since many of you are tuning in from around the world, I just want to give you a quick intro to what Northwell Health is before we dive in and tell you all about Nora and give you some demos. So Northwell Health is centered in the New York City area and surrounding areas into Long Island, Westchester, as well as some affiliated hospitals outside of that area. We're a pretty big health system, one of the largest in the United States. We have 23 hospitals, about 750 growing every day, outpatient facilities, and over 70,000 employees. As I'm sure you can imagine, that comes with thousands of clinicians. And for those of you in healthcare IT, you'll know that it also probably comes with a few hundred different clinical systems holding our data here around Northwell. So I want to dive right in and talk to you about Nora. So I want to start by giving you a bit of the background. Here at Northwell, we have an innovation challenge that we run every year to collect innovative ideas from around the health system. People go in and they do Shark Tank-like pitches, and every year we have about 100 to 150 entrants who go in and vie in this Shark Tank pitch for to receive funding for their idea. So my boss, Vish, actually pitched Nora as an idea a couple years ago and was the co-winner of the Innovation Challenge. And so that was the first Nora that came to be here at Northwell. And since we've built that out as a pretty robust product offering and rolled it out to 10,000 clinicians here at Northwell. So when they proposed this idea, the whole concept of Nora was as physicians and clinicians continue to feel the stressors and the burnout of all the technology that's been thrust upon them in healthcare, we wanted to build something that would actually delight clinicians and showcase how technology could help them care for their sickest patients quickly and easily using technology to help them. As many of you have seen, I'm sure, when you go to the doctor's office, quite often your doctor is spending more time looking at the computer than they are focused on you. And we wanted to give the provider back their hands and get them back in front of the patient doing what they do best. So here in the corner, I have just a shout out to the team who won the Innovation Challenge a couple years ago with Nora, including Dr. Vishwanath Shaman, the leader of our team, and our Chief Technology Innovation Officer here at Northwell. All right, so with the history lesson behind us, let's go ahead and talk about what Nora is right now, and we'll share some stories as well as some demos about the product to give you an overview. So Nora is a virtual assistant for clinicians. It's evolved since its original entry as an EMR bot and started to do much, much more. So really we see Nora as sitting between the clinical systems, including our many EMRs we have here at Northwell, Microsoft Teams, which is our primary delivery platform, and a series of actionable rules and intelligence that really allows you to have that full end-to-end experience to get really direct and quick access to your clinical data, as well as some intelligence around it. So using Nora, our clinicians can access clinical data about their patients from their mobile phone in less than a second. That could be lab results, vitals, notes, medications, radiology images. We've also, based on initial user feedback, started to go beyond just showing you one or two pieces of data and started to put together intelligent clinical summaries to give clinical users a quick at-a-glance view of everything Nora can show you that's relevant to you right now as you're treating a patient. The first one of those was the COVID summary, which we'll demo to you, and I think Dr. Baker will also share some of his experience with the COVID summary, which was used very heavily during the pandemic here in New York City at Northwell. Beyond the summaries and the ability to go in and view data very quickly in Nora, we've been driven by our clinical users and our advisory team to really allow Nora to send some actionable real-time alerts that the users can subscribe to if you're waiting for a lab result to finalize a treatment plan for a patient, if you're waiting for a consult note to finalize a discharge. Nora can provide the information to you in real time in Microsoft Teams, which is secure and PHI safe. We've also started to add a lot more rules and calculators into Nora. So as doctors are going around the hospital and treating patients, quite often they need to know a risk score or calculate something that will help them define the treatment plan for a patient. Nora aids in that clinical decision making by making those scores and calculators readily available right on their mobile device with the data pre-populated straight from the clinical record or records. Because Nora is embedded in Microsoft Teams, which you'll see in the demo, that also allowed us to do some really valuable collaboration. So using Nora, you can add Nora to your chat with another colleague and have Nora, the bot, be part of that conversation, sharing clinical data about the patient, making information available, and even sending alerts so that you can have a really robust clinical conversation within a virtual rounding team within Microsoft Teams. And lastly, as I've already said, but I think it's worth saying again, Nora, because it's embedded in Microsoft Teams, gives you mobile, secure, and PHI safe access to your data, even when you're not on your hospital network, which is very valuable for clinicians who are going between locations and even checking in on patients at night from home. We're going to go into the demo in a second, but just to close the loop on sort of the overview of Nora here, essentially I want you to think of Nora as the virtual assistant for clinicians, where at any point they can say, hey, Nora, show me the latest lactate for my patient. Show me the latest CBC for my patient. What's the risk of readmission for my patient? And Nora will present that information back to them in a very easy, clean, readable way right at the moment that they need it. And we do focus really hard in our engineering team to ensure we have the quickest response times possible, with almost every query in Nora coming back in less than a third of a second. So now we're going to go ahead, now that I've told you a lot about Nora, I want to go ahead and show you a demo where we'll walk through everything we just mentioned, including quick searching in Nora, some of the intelligent summaries that we've built into the product, as well as the ability to get real-time alerts. As I mentioned, Nora is embedded in Microsoft Teams. I'm going to go ahead and open up Microsoft Teams on my mobile device. You'll see a little Nora icon right here in the bottom application tray. By clicking on that, I can immediately start searching for clinical data about my patients. For example, if I'd like to find a lab result, I just type the name of the lab result or a common alias like CBC for a complete blood count, followed by my patient name, and I send it to Nora. Nora returns all the latest complete blood count results, including complete blood count with AutoDiff. I can click on the one that I want, and Nora will show me that lab result. As you can see, anything that's abnormal is highlighted in red, and I can click on any of these items to see the full reference range as well as any notes associated with the item. Some of our users prefer to use voice, and because Nora supports natural language processing, we can easily handle that as well. Show me lactate for Molly Cooper. And just like before, it will pull back the results. You click on the one you're looking for, and you can go ahead and see that. During COVID in particular, we saw clinicians were often searching for the same set of things in a row, and so we started to put together smart summaries that would make it really easy for them to see several pieces of data that they needed to treat a patient. So COVID Summary Cooper was our first smart summary. Now we have several clinical smart summaries as well as time-based summaries such as last 12 hours. Here I can see several pieces of data relevant to COVID, including lab results such as ferritin D-dimer, as well as vital signs like temperature, respiratory rate. At the bottom, I even have a link to allow me to directly open up any chest x-rays and radiology images available for that patient right from my mobile device securely. In addition to viewing data in Nora, you can also get alerted when there's new information available for your patients. By typing Set Alerts Cooper, I will be prompted to choose what alert types I would like, such as lab results, radiology images, even a new fever alert. I can choose how long I want it and then go ahead and set alerts. Since I set alerts for lab results, the second there's a new lab result available, it is sent to my phone, and here I have a new COVID test result. As you can see, it gives you the full result so you can take action immediately. And that's all sent securely within Microsoft Teams, courtesy of Nora. Thank you for sitting through that demo. We hope that it gave you a perspective on what Nora is and what Nora does. But now to shift and give you a real-life clinical perspective, I want to pass to Dr. Baker to share his stories of how he has used Nora over the last several months here at Northwell. Dr. Baker?
Thanks, Kim. Nora really has been an incredible game changer for me, and she has provided a lot of freedom. Really, the exceptional pieces are quick, easy access to everything I need in the EMR, whether it's notes, vitals, labs, everything. I am often not in front of a computer, whether you're in a meeting, you're away from the hospital, really kind of on rounds going around. The issue will come up as to trying to follow up on a patient, trying to get the most up-to-date information on a patient. And now with Nora in my pocket on my phone, I can do that in a matter of seconds. So I can instantly, with Nora, find the patient, add the patient to my list, and then really get into the clinical information that's needed. As an anecdote of this, one of the most impressive times when I used her, we had started using remdesivir in COVID and anticipated that this was going to have a high need. And there were clinical criteria to be able to prescribe remdesivir, and it fell to the medical director to be able to approve this medication. And I would get calls. I wouldn't necessarily be in the hospital asking whether or not we could provide it to a particular patient. And I would just ask them to hold. And then within a minute, I could look up the patient, know what their oxygen saturation was, know what their GFR was, a couple of other labs, and know whether or not they qualified to actually receive remdesivir. It was just incredible to be able to do that, and really to be able to do that from anywhere in the world if I had been able to travel. We have introduced Nora to a variety of clinicians. It really, it comes with its own tutorial, but it's pretty simple to just immediately start pick up and using. We gave it to a group of cardiologists, and within the time period of getting Nora access, a few hours later, the cardiologist wrote me back and said, "This is just incredible. I checked on my patient that had a cath the day before. I was already able to look at all of their radiology images. I was able to get the update on the notes and all of the labs, and just did so seamlessly." One of the other attributes that really Nora is able to offer, it's incredible, is to be able to collate all of that data, all of those discrete data points in one summary. So Nora has what are summaries, or what are called cards. And so all of these data points can be put together. The COVID summary was one that you saw. And what was really helpful about this was it gave a general understanding for how sick a patient was. We were constantly trying to really gauge what the influx of COVID patients we were going to need in terms of the level of care, and being able to get all of those data points that were germane to that particular disease entity and have them just there in seconds, which just, again, really quite extraordinary, and not something that I had ever had access to before. So we are actively trying to adopt Nora in almost every clinical scenario. Our neurosurgery team has adopted it in a fantastic way, in that our PAs are now able to tell the attendings when the attending calls and says, "Hey, is that back yet?" or "Has this lab come?" They can just simply say, "Go ask Nora," because the information is already in Nora. And more importantly, you can set up alerts. So there have been a couple of times where there has been one particular lab that everybody's waiting on, and there are a variety of downstream effects of that lab result. I can go in, set the alert for Nora, and then I get the result instantly as soon as it's ready, because Nora pings me and says, "This result is there." It has really changed also the way our teams interact. It's embedded in Microsoft Teams, so we can take those results and then actually communicate in a HIPAA-safe environment that, again, can be outside of our normal network. And we're all able to then collaborate and really create a true interdisciplinary round-type scenario really anytime throughout the entirety of the day. It's been quite impressive, and we're now structuring some different things with our care team so that we can get them all together and get them all chatting actually within Nora and Teams together. And I think Kim's going to take us through a couple of the new things that she's able to do.
Thank you, Dr. Baker. That's a perfect segue into the next part of our conversation here. So we want to go right into another demo. And in this demo, we're going to show you not just the individual clinician's experience of searching and finding quick data in Nora, but how you can leverage Nora for more population level alerts and true care team collaboration. So we're going to show you a couple things in that area. During COVID in particular, one of the things that was heavily requested by not just our doctors and physician assistants and nurse practitioners, but our emergency room coordinators and our bed management team, they were constantly wanting to know when a patient's COVID test came back for any patient in the ED, so they could plan their location management and what type of unit and what type of room that patient was going to need. So as part of that, we've developed a series of specialty alerting, as well as the ability for you to identify care team members, collaborate with that care team, and even run queries on the fly to create a list of patients for you that you need to follow up with. So we're going to go ahead and show you this in a quick demo.
All right, now I'm going to show you some of the features that help coordinate patient care and collaborate across the care team with Nora. So in addition to the patient level alerts that I showed you a few minutes ago, we also have facility level alerts that can alert our senior level users on some important results or flags for patients across their facility. One example of this is Set Alerts COVID. That allowed them to immediately begin patient care or transition the patient into the right level of care, the right unit, the right type of room, based on their result with immediate knowledge. Some of our users need to quickly locate a full set of patients using a set of criteria when they're managing patient care, discharges, quality, or other things. So let me show you an example of that in Nora. Show me patients who are COVID positive and have hypertension. So what Nora's going to do there is it's going to leverage our indicators from our clinical data and on the fly create a report that assembles patients who meet those criteria. You could add additional criteria to that. You could say by facility or in my facility. And so Nora will give you an immediate list of all the patients you're looking for. And of course, this is quite flexible and configurable. The last thing I want to show you is how a user can identify the best, most recent care team for a patient and then collaborate with them virtually within Microsoft Teams. So I'm going to ask for the care team for Molly. And Nora, based on all the data we have from the clinical record, we're going to help identify the best care team. I can see that it has identified who the attending is for Molly, as well as who has recently interacted with her record, who has written a consult note, who's written the recent progress notes, who's administered medication or made an order. And by looking at who has interacted with Molly's record recently and how frequently, we can put together a smart care team so that anyone who needs to get in touch with someone who's caring for the patient can know who's most recently interacted with that patient in a very quick and easy way. And then, because Nora is built right into Microsoft Teams, you can select members of this team and immediately begin a virtual chat with this group. So you could say, hey, can we chat about this? And then, because we have Nora, I can hit this plus sign, immediately search for clinical data to share it with the group. So I could say, hey, I want to discuss her latest lactate. I can grab that lactate, hit send. And now the whole team that I'm chatting with of my colleagues and the people who I've selected from her care team will receive this data securely, and we can begin an engaged clinical discussion around the treatment of this patient with all the data right in front of us. So as you see, with the power of Nora, Teams becomes a true virtual clinical collaboration platform.
So as we walk through that demo, I hope you got a view of not just how Nora is valuable to the individual clinician, but when you're working within care teams, when you're working at Dr. Baker's level, at the medical director level, or even the quality team. Some of our top users of Nora are actually the quality team members who are reviewing across patients and identifying risk factors, identifying isolation needs, identifying bed needs, etc. And so even though Dr. Baker shared some great words about Nora, thank you very much, Dr. Baker, I do want to give you a few other pieces of data around how our users have been responding to Nora. So Nora, as we mentioned, won the Innovation Challenge a couple years ago, and then it took a little while for us to then put the team together and start building Nora out. So we actually started our first pilot at the end of January this year with a specialty unit at our children's hospital, a specialty unit focused around hematology and oncology. So right here you see two of our first Nora users, Dr. Atlas and Dr. Zahair, and we started off with about 10 users in that department just to sort of get a sense of if the Nora features are valuable, and they worked very diligently with us to move Nora very quickly from that pilot to enhance what was available in Nora and make it much more valuable all around so we could roll out to more and more clinicians. So since that small pilot, we've turned on Nora for thousands of users here at Northwell. And so far we've had about 3,000 and a little over 3,000 distinct clinical users coming into Nora and looking for data, setting alerts, and accessing calculators and risk scores. So far, that's led to over 120,000. I got these numbers yesterday, so it's probably up to 125,000 now, but over 120,000 different individual searches and requests in Nora, looking for clinical data on a series of patients. And that's also led to over 40,000 timely clinical alerts being sent out to our clinical team members, our patient care coordinators, emergency room physicians, et cetera, across Northwell. So we always get great feedback from our users. We look not only at the data to see if users are having a good experience with Nora and continuing to come back to Nora and use more and more of Nora, but we also reach out to our users pretty frequently to collect their anecdotal feedback. We want to hear what they think of the product. Because we're in a unique situation that we are building this product here at Northwell, we have direct access to those users, and we want to make it the best product and the most valuable product for those users. So I just want to share a couple pieces of feedback. And Dr. Baker, I didn't prompt him to do this, I promise, but Dr. Baker said this one as well. But I would say one of the most frequent pieces of feedback we get for Nora when we show it to someone new or we follow with a user who's been using the product for a few weeks is Nora is a game changer. For users who are, and clinicians who are in the hospital and so used to having to go and find a workstation to get into the EMR and go through the login process, go in, find the patient, and then find the data they need. The idea that when they're just walking from their car to the parking lot, walking into the hospital, getting out of the elevator, the fact that they can look up one of these pieces of data or many pieces of data on their patient within a split second, that really, for a lot of the clinicians we work with, is a game changer. And so we always love to hear this feedback. Another one that we get pretty frequently, and we always love to hear it as well, is people reach out to us with very specific stories on how Nora helps them get their patients discharged more quickly. Either they are waiting for, the final echo or the lab result or a consult note. Getting that in real time from Nora lets them proceed with that discharge process, even if they've already left the hospital for the day, because it comes right to their mobile device securely, and they can take whatever action is necessary based on that. So we get those reach outs all the time from our doctors and ACPs, our physician assistants and nurse practitioners, telling us how Nora helped them get their patients, successfully discharged in home, which is where most patients would rather spend their time at home than in the hospital. And the last one I want to share was one that a user actually typed into Nora. So because Nora operates in Teams like a chatbot, sometimes people send messages right into Nora, which we always find funny when we see it in our usage logs. So this was one from just a couple weeks ago where a user said, "Thank you, Nora, life just got a little bit easier." And so if I circle back to the beginning of when the team presented Nora into the Innovation Challenge and said, hey, we want to build something that actually delights clinicians and makes them see how technology can help them with their clinical care, when we get comments like that, it really drives it home and says that we actually have started to achieve with Nora what we're trying to, of making doctors and nurses and the rest of the clinical care team make it easier for them to use technology to do the right things for their patients. And so speaking of technology, because this is a technical conference, I do just want to give a quick overview. I'm not going to get into all the weeds of the tech, but I will tell you a few pieces of technology involved here and how we built Nora. And then we will be able to take more questions on technology in the chat at the end. So here at Northwell, as anyone from any health system knows, especially once you have as many hospitals as we do, you end up having many, many clinical systems. So we've got a few hundred here at Northwell, including at least 3 EMRs. Many of our hospitals are on Allscripts, but then we also have some hospitals on Cerner and Meditech. So we have data from all those systems, as well as up to 200 others, including lab systems, case management systems, et cetera. On top of that, we have our InterSystems HealthShare HIE platform, which I'm sure most people at the conference are pretty familiar with. And so from the InterSystems HealthShare HIE, it allows us to aggregate and have data from all those systems come together in a composite and aggregated way. And that's what we use to then drive the content into Nora. So last time I checked, we have over 3 billion pieces of data in our InterSystems HIE. And we're adding, hundreds of thousands of pieces of data every week from around our patients at Northwell and in our ambulatory space as well. So once we get all that data into the InterSystems HealthShare HIE, we then take it, and Nora is entirely a cloud-based platform. We at Northwell, we're in Microsoft Azure Cloud. And so up there, I'll just talk about a few bits and pieces that we are using to make the Nora experience everything we want it to be, including performant, and intelligent, etc. So we are using FHIR as our primary data model in Nora. That makes it really easy for us to normalize and to get very quick access to data as needed. And then on top of that, we do leverage some of the other components from Azure to give us the bot framework, really fast Azure search, as well as APIs and some natural language understanding with Lewis. So we pile all those things together to really give the robust Nora experience that you see. As we mentioned, and as you saw in the demos, Nora is heavily based in Microsoft Teams. So at Northwell, everyone who's using Nora has it embedded in their Microsoft Teams where they can see it on desktop or browser or mobile phone. Wherever they use Microsoft Teams, Nora is there. They click on Nora and they can chat just like you saw in the demo. But we also have a couple other ways that Nora can be made available. So I just want to mention those really quickly. So we've built a React or a web version of Nora that can be embedded in other applications. So here at Northwell, we call that the Nora Snapbot, and it's currently live in a few different applications, one of which is the HealthShare Clinical Viewer. So at Northwell, we have many users who use the HealthShare Clinical Viewer to access data from the HIE and the composite health record. We have now snapped Nora in there with our React Snapbot experience, so anyone can use that Nora experience to search the entire HIE clinical record and surface the data they need, as well as access our calculators, our risk scores, our intelligence summaries, etc. So that's rolled out across Northwell to our 10,000 plus clinical users. We also have a few other Nora applications that have started to come along, and a lot of these were driven by some of the early requests from Dr. Baker and his team. So we've recently deployed Nora specifically in an application for interdisciplinary rounding and discharge planning. That's currently live in our largest hospital, North Shore University Hospital, in a few units, where it's using the Nora-based experience to assemble all the data that you're tracking as potential barriers to discharge, potential risks to discharge, and helping the care team navigate that through discharge planning in a single app with the full power of Nora behind it in terms of giving you access to all the data you need. We've begun the process of getting to a pilot on our Nora bedside product, which is essentially taking everything you saw in the Nora demo and making it available by voice at the patient's bedside for clinicians who are in and out of patient rooms. They can hands-free get access to pertinent data from the clinical record by just asking a device in the room and scanning their badge for security. And lastly, you saw a little bit of this in the last demo, the Nora Q&A feature. That's the next thing we'll be rolling out throughout our users at Northwell to give people who really want to just get a really quick list of patients who meet certain criteria. That is something we'll be rolling out to several of our senior users over the next few weeks into a month. And we're really excited for that next iteration of Nora to go to more of the population level and not just the single patient level. So that's a bit of the tech. But I think we're pretty much at time. So I would like to thank you so much for joining us today, and especially thank you to Dr. Baker for sharing his perspective on Nora, and of course also contributing very heavily to the advancements we've been making in Nora over the last several months. Our team will be joining the chat for Q&A, so please come and ask us any questions. I'll be joined by Vish, our Chief Technology Innovation Officer, Nick Lorenzen, who's our Director of Software Engineering, as well as our partners from Andor Health. Andor Health is our strategic partner for go-to-market opportunities for Nora, and they have a large virtual care and virtual health platform as well. So if you have any questions, feel free to come over, join us in the chat, and we'll answer as many as we can. And you can always go to northwell.edu/Nora for more information. So thank you again, and thanks again, Dr. Baker.